You're all being let in from the waiting room. And while we're doing this, if you want to, go ahead and select the speaker view in your, in the upper right-hand corner. You'll see there's like a little tab that says speaker view. And that'll hide all those other little boxes. And then you'll only be able to see the people who are speaking. So I think that's how speaker view works, but as opposed to gallery view. The gallery is not that interesting because we have muted everybody and hidden you just so that you can, so we don't get too many interruptions and distractions when people's dogs bark, other than mine, for example. So anyway, we have some more people kind of popping in, and let me just check the time. Okay, great. So first of all, let me just say a huge welcome to the Daughterhood Conversations today. We're going to be talking about navigating the healthcare system. And so as I mentioned before, your video and audio are going to be muted, but you can key in questions in the chat function. So, and we'll try to keep an eye on those as we go along. And really, I think this conversation in particular will really be kind of enriched by your observations and questions, because this is something that kind of we all experience, and I don't know that we talk about it that much. So that is, by this, I mean a really frustrating healthcare delivery system. So we are recording, and the good news is that then if you want to revisit anything we talked about, you'll have it. You can share it with other people that you think might be interested. It will live on our website. So, keep that in mind. And there is my dog, just perfect timing. You can, yeah, just keep that in mind as you write things in the chat, because that will be recorded. So if you want to complain about your sister, maybe you don't want to do that here because it's being recorded. So, so let me just say, first of all, that these Daughterhood Conversations are conversations with and Daughterhood Circle leaders, and I'll talk a little bit more about how this all came to be in a second. But the Daughterhood is an organization that it's not even an organization. That's probably too strong a word. It's, for those of you who don't know, it's the thing we all need right now. It's a community. It's a community of people all over the country that come together through a variety of different sort of media, whether it's social media, our website, Daughterhood Conversations, our circles, our podcasts, to try to just support each other and share solutions with each other. So we're not all inventing this from scratch all by ourselves all the time. So really, we just want to support you as a community. We want to build confidence. We want to give you a sense of not being alone. Roseanne Corcoran is the most amazing podcaster ever. And we are so lucky that she is our Daughterhood podcaster. And every month, she's really just got a tremendous kind of set of podcasts already kind of in the bank. I think you can find them you can find them on our website. You can find them on Apple, iTunes. Just please follow her, check that out. She's the real deal. She's very professional, and I'm just so I want to give her a plug. We're almost done with the housekeeping, I promise. So here's, I just want to sort of so Daughterhood Conversations is sort of it's a program we launched because we felt like a number of us who are Daughterhood Circle leaders were getting together during the pandemic over Zoom and kind of for the first time, just having these very rich conversations with each other about a very wide variety of issues facing caregivers. I mean, really wide variety, because there are so many. And then I think one of our circle leaders, it might have been Christine from San Diego, had this brilliant idea. She's, wouldn't it be great if this was recorded? So everybody could kind of be part of these conversations, and it wasn't just happening among just us. So we decided, well, heck, we we should take a lot of these topics and divide them up into individual conversations, and then invite our circle leaders to come, and many of whom are experts in a wide variety of areas. And we just like, let's have our conversations, but invite you to be part of it. And and so in that sense, I want to just keep your expectations also in line. Like, this isn't a webinar. This is just a conversation, and we'll try to sort of answer questions, but we might not know the answer. But we want to normalize the experiences all of us are having, and kind of give you the benefit of being part. It's a community building exercise, I think more than anything. So oh, yay, I see Elizabeth Miller in the chat, and Kiki, and some of our other Daughterhood Circle leaders. So yay. Great. So let me just say a quick word about the, hold on one second. All right. A quick word about the, about who we had today in the conversation. So two folks I'm really excited to introduce to you. Robin Weeks and Jean Ross. They are both Daughterhood Circle leaders, and Robin leads a circle in the New River Valley, Roanoke area of Virginia, and is also a certified caregiver consultant with Denise Brown's program. And she is the owner of a corporate training, coaching, and leadership development company called My Pivotal Point. You can see her website there. She's been a family caregiver, and I think really brings like this incredible combination of professional skills and personal experiences, particularly in dealing with all of the healthcare providers that we have to deal with. And she'll be talking about that. And then Jean Ross is just a total treasure in the Daughterhood community and the Daughterhood circles, is a nurse, as you can see from her picture. And she's been in a wide variety of roles. I think one of the things that has been interesting for me in getting to know her is her role in critical care and ICUs and what that's like. So from a provider perspective, you'll hear from her a little bit about what's kind of going on in the heads of people working in an ICU and the different parts of the hospital and how they communicate with each other. And she's taken all of that expertise and knowledge and turned it into a business that she does a sort of helps families now with care coordination, among other things. And she is trying really hard to kind of scale that support in a technology solution called Primary Record. And so hopefully I got that all right. You guys can you can correct me if you want to correct me, you can correct me. So anyway, that was all really fast. If you have questions, please, like I said before, put them in the chat function. We'll really try to get to every question. I know that can be frustrating, but be patient with us. You can also always email us through the website. There's a place you can put your questions in, and they all come to me, and we try to answer all of them. So if you can't get your question answered here, or you want to say something, there are lots of ways to communicate with us, and we really encourage you to use them. And please sign up for our newsletter if you haven't already. Okay. Whew. That is all of the housekeeping. And there's so many messages in the chat already. This is awesome. Okay. Oh, thank you, Susan. This is great. Okay. All right, everybody. So I'm going to stop talking, and we're going to start having an actual conversation instead of just me talking. So I thought we would start, like, Robin, would you mind starting and just talking to the larger group here about your personal experience with your own parents? Because I think and some of the experiences you had dealing with healthcare and how that led you to even be interested in talking about this today.
Absolutely. Yeah. Thanks, Anne, so much for doing this and for having me here with Jean. I'm really happy to be able to share what could be helpful to other caregivers out there. Yeah, so I started caring for my mother after my father died. And as a lot of those caregiving experiences started slowly. It was traveling to Tennessee once a month to just check on her. And it hit a point where it was became quite obvious to me, especially after a conversation with her doctor, that she needed to move. And I am owner, as you said, of my company, and the travel was wearing me down. It was more than I could handle, or it was becoming more than I could handle. So at any rate, moved her to Virginia into a low-level assisted living apartment, and had her out to my house on weekends, and we had a lot of fun for a few years. And things started, ER visits, hospital stays, fall, those sorts of things that start stacking up. She ended up having to be moved after one hospital stay to the second tier assisted living, because she then became wheelchair bound. And that meant more responsibilities for me. A lot of people think assisted living means you can hands off, but it's total opposite, really. Because when you're not there, you don't know what's going on. You hope what's going on is what you want to go on, but a lot of times it's not. And there's a lot of things you have to keep up with, and they're often short-staffed and very busy. So at any rate, she was in the assisted living tier for about 2 years. Again, ER visits happen, hospital stays happened. Those are all experiences I'm sure we'll talk about today with Jean. And I learned a lot. She eventually, in the fall of 2017, she had a hemorrhagic stroke. And she died in January of 2018. And so I went through the hospice experience, which was my second experience with hospice because I had it with my dad. But I guess, what I could say, speaking about the healthcare system, is that I went into this, like, other than my own personal experiences in healthcare, I knew nothing about being an advocate, a care manager, what I needed to do for her when she was sitting in an ER room not being attended to, or when she was moved from an ICU unit, which she was in at one point, to a regular room and left for 45 minutes. And I learned what I needed to do. I learned how to talk to the healthcare people. I learned what questions to ask. I learned to look at them as a team of people, just like I looked at the team of people in assisted living that cared for her when I wasn't there, as part of my overall caregiving teams of people that I had come to rely upon. The healthcare system, it can make you pull every hair in your head out, especially with an elder adult, because as we all know, with elder adults, when they go into a hospital setting, an ER setting, their cognitive function tends to decline almost immediately because it's frightening, it's unstable, they just want to go home. And if you're not there to advocate, to ask questions, to get the attention for them that they need, then they often don't get it. I honestly, one of the things I think we talked about before was, after having so many of those experiences, I wrote to the ombudsperson in 2 hospitals where my mother had been, where she had been kind of ignored for a very lengthy period of time. And I wrote to the CEOs and I said, you need a person on staff that knows how to care for elderly people. You need to educate your ER doctors and your nurses and so forth. Pardon me, Jean. Elderly people need a different level of care. They need a different level of attention, and you need to pay attention to their advocates and their family members. I didn't get anywhere with that, but it made me feel better that I did it. All right, so that's kind of a synopsis of my healthcare experiences with my mother in brief. I'm sure we can get into other details once Jean and I start having our conversation.
No,
Yeah.
just picking it right back off that, Anne, because it's funny to hear you, Robin, talk about your learning curve at becoming a caregiver, because I definitely lived on the other side as a nurse or a provider in the system, right? And I watched families navigate. I had no clue about, or just like really awareness of the struggles that family caregivers had. Because here's the thing. So especially as a newer nurse, or any healthcare worker, you're kind of pigeonholed into one, you focus on the patient in that bed. That's the most important. And two is that you're regulated to one very small part of a very big care continuum, right? I don't own any of that care continuum. You know, the family caregiver has to, but I'm an ICU. My goal is to get you extubated off these drips, get you to the next spot. And, you know, it wasn't until I took a role in my hospital where I was forced to move around to different units and different levels of care that my eyes started opening to the role of family caregiver. And really what it became of is, you know, my own inner nurse trying to understand, why do some of my patients do well and why do some of them not do so well? And the observations that I finally concluded, I was like, it's these darn family caregivers. You know, though we all want to avoid families and the doctors will set up their rounds when families aren't allowed on units. That is all true in healthcare. We want to avoid the heck out of you guys.
Yeah.
But at the same time, we need you very much, because you are part of the reason some of our patients live when we didn't anticipate them to live. And so after that hospital stay, like I moved away from there and a lot of family situation and trying to be a nurse and working 12 hours. But I had this opportunity to coordinate, to start a business where I just got to like walk alongside family caregivers and experience that entire continuum and coordinate and try to navigate healthcare on behalf of them. And I think it's one of the reasons I was drawn to Daughterhood, was this idea of community and sharing information, because doctors struggle getting their parents through this healthcare system. Nurses struggle getting their parents through. Like, it's not you guys. And so, you know, today's conversation, there's a lot of Robin's story that I hope, you know, we can get to of just realizing when you're in that moment of pulling your hair out, likely your healthcare team feels the same way. Because no one's trying to hurt anybody. We all took oaths. We usually all got into this profession to do much good. There's a different evil out there, but yet it's so easy to blame the people right in front of us.
Yeah.
And so what can we do together, you know, in this conversation and start building out how we can change it? Like, how do we want this all to look to make sure people get the care, families get the resources that they need?
Yeah.
And you know, and that's why I just love Anne and all the things that she's doing with Daughterhood, and why I do.
Nice of you.
It is. It's an incredible thing. Like, because that's the thing is, it's a very isolating experience.
Yeah.
You don't realize it, because in the acuteness of it, everyone wants to pitch in and bring a meal. But what do you do when someone's got heart failure until they die?
Right. And
You're not going to bring a meal every week.
right. And I think you said something that's so important, and I just want to insert it really quickly and then I'll step back out and be quiet. But like that we're all, you know, this sounds really like a cop out almost, to blame the system, but there is this, you know, you have nurses and physicians and and a whole bunch of healthcare workers, you know, in a variety of different roles that are working they have jobs that are working within the system. And the system is sort of, you know, these hospitals and these health systems and skilled nursing facilities and physician groups, and they've all kind of, this whole way that they work together has evolved over 30, 40, 50 years. And honestly, just kind of in response to how they get paid, right? So it's like, you know, you go to the doctor, they see you in their office, they submit a bill, they get paid for that visit. You know, you go to the hospital, like the And so as a result, you know, like just getting, like in my parents' care, just getting the primary care doctor to even know what the oncologist is doing and to advise my dad about whether or not, you know, he should continue chemo or not is like a huge undertaking. I'd be like, call and complain and beg and like, what's happening? And, you know, so but that primary care doctor is just operating under the system. So we as family caregivers are basically, we're like,
You're the only link pulling it all together.
We're it.
No,
like, and I've had so many family caregivers say to me, like, why am I managing all this stuff? Like,
yeah. And
no,
know, the thing I need to insert this, I'd like to insert this too as well, is that to the points for both of you, is that So I worked with an adult daughter who was caring for her parents, elderly parents. Her father was in the hospital. She didn't really see herself as a caregiver because they'd been pretty healthy until then. But her father was pretty sick. And I was having a session with her, and she said, I felt like I should leave the hospital, his hospital room. I thought he would get better care if I wasn't there. And I asked her, so why do you think that? She said, well, I just think they think I'm there, so they don't need to come in. So we had a long conversation about why it's the exact opposite of that, and we talked about things that she could be doing and so forth. And I think also to your point, Jean and Ann, about the healthcare system, there's the oncologist and there's the PCP and there's the nurse and I did this course on creating caregiving teams, and I had people watch this TED Talk video called Teaming, which I will send you the link so you can send it out to everybody. But the woman talks about healthcare, and she says this is a team of professionals with different levels of expertise that come together. And I think what I said to this woman whose father was in the hospital, I said, one thing you have to remember is that they all have the same goal, and that is the well-being of your dad. And you need to keep that top of mind. Your goal is his well-being. Their goal is his well-being. But we're all going about it in different ways. Mm-hmm. But if you think about what the intention here and the overarching goal is, it's his well-being and what's the best thing to do for him.
Right. And I think that's the biggest thing that I had to, when I was working with families and with their older parents, because I got the same thing, Robin, is they're like, who's driving this train? I'm like, you are. I know you didn't ask for this.
Yeah.
But, there's a lot of doctors, and it is crucial. It's crucial to have this conversation with your parents on what's important to them, because it's going to be, because that's going to help you frame it because like as a nurse or doctor, we throw everybody in the same uniform, right? Those ugly green scrubs. I don't care if you're rich. I don't care if you're poor. I have no idea who you are. I don't know if you're blind in your left eye until I start reading all my chart or whatnot. And so when I have families that can give me those insights of, my dad just really wants to go to Disney World with my kids next year. What that does for your healthcare team is it helps them kind of prioritize what's important, right? Mm-hmm. And then you have other parents that are like, I'm afraid to die, I want all measures. Then that's what you do. And everybody's different. And so that's why doctors don't make those decisions. And a lot of families wait. It's like they're just waiting for the doctor to tell them what to do. Yeah. And because it's super scary, it's scared to be in charge of somebody's life. It's scared to walk. It's in the most, I mean, my parents just started having we're just having the Medicare conversations. And I do this for people and I'm like freaking out because I don't know what to do because it's my own parents.
Yeah.
You're not clear-headed. It's because you have you have a lot of emotional into it. So that's another, I think, purpose of daughterhood is like you have a place to bounce that off, to understand and remove some of those emotions, to figure out what is the best thing to do in this situation. It's hard to do.
What the medical team would say is the best thing, because the medical team's job is to save lives, get them well, right. Send them home healthy. And it doesn't always happen that way. I mean, I think I shared this with you, but, I sprung my mother out of rehab one time. She had been in a hospital. She had a hospital stay. She had to go to rehab. This was her third or fourth time in rehab. And she was so depressed. She was in the other wing of her assisted living building, and she was taking herself down to her room in the afternoons. She hated it so badly in her wheelchair. Just, I'm like, okay, let's get you out of here. This is not doing you any good. Get you out of here. So we convened a meeting with all the powers that be, and we got her out that afternoon. And, maybe it wasn't the best thing for her to quit rehab, but she didn't want to go. She wasn't happy. She was depressed. She wasn't eating. And I think, we, as you said, with the, there's so many emotions that get involved in this. These are our parents. It's hard.
Robin, can I ask you a question about that? Because you just made me think of something. And like, we get a lot of questions through the Daughterhood mailbox about what you just said, just what from family members who are trying to get something done in the healthcare system to meet to honor the wishes of their loved one, and they're meeting with resistance. And I think it can be really intimidating,
Mhm.
particularly in the rehab setting, where it's like my mom wants to go home, but they're telling me that if she, that she's not, you're sort of like, any advice for people in terms of, and I don't, we're pivoting to advice, but just my thought process here was, like, how do you, for both of you, really, how do you overcome feeling intimidated so that you can state the wishes of your family member, get your questions answered? I mean, there's a way to work with people, but also a way to just get the self confidence you need to feel comfortable
Mhm.
pushing back or asking for what you need. And that seems really hard for a lot of people just based on what I see in my inbox.
Well, it's hard because at least in my parents' generation, especially, the medical people, they have all the answers. We just listen to the doctor. What does the doctor say? Um, and now we question everything. We Google everything, and we come up with our own questions and answers. But for me, I think it was more a matter of gaining the confidence over the long series. I cared for her for almost 7 years of, ER visits and hospital stays and just figuring out, okay, I'm not getting anywhere by making demands and being what. I get much better response when I am polite and I am nice, but I am firm and I ask for what I need. And if I don't get what I need, then I ask again. And but yeah, and that's where, like, when Jean was saying about the emotions, it's like I knew it was probably better for her to continue to have the rehab 5 days a week that she was getting. But if it was compromising her mental state and her desire to eat and engage, was it really better for her?
Mhm.
And I think, I mean, you have to have, at least I think, as a caregiver for a parent, or someone you love, you have to get to that point where you're like, what's, I mean, for my mother, she's in her 90s, She said to me all the time, I'm ready to die. I'm ready to move over and let somebody else have this spot here. And so it wasn't like I felt like I was hurrying up her death or anything. It was like, why should you be unhappy?
Mhm.
If you're not going to work at this, why should you be unhappy about it? Let's get you home.
No, listening to Robin's story, I can just picture the chatter behind the scenes of the nurses. Usually
Yeah.
we have and this is where, because there are a lot of families that get pissed off when we make recommendations of palliative care or hospice, right? It feels like we're giving up on you.
Right. Right.
Um, and honestly, nurses, because we do it over and over and over with a certain subset of population, we get usually pretty good at pinpointing when someone isn't going to succeed and when someone isn't. And we feel like we're torturing them when we're putting them through emotions. And so I think a lot of it is in our heads of the dynamics of the relationship. It's also really hard when the nurse is buzzing in and the doctor's got his hand on the door. It's hard to communicate to healthcare workers, especially now because they're so short. But when you are bringing up a topic that they probably feel the same way, and so it's almost like this mental trick
Mhm.
of what if they are also thinking the same thing? What if
Yeah.
they're also hearing
Yeah.
my mom say, "Can you just please let me die?" Because I had patients doing that to me too, that wouldn't tell it to their family, and that was hard as a nurse to keep doing these things to them when they're telling me that just please let me die, but they would never feel comfortable to tell their kids about it. So on the flip side, nurses get put in that situation too. So I think my advice is, and then there's just personalities. There's a bunch of human beings in healthcare. So there's so much variability. So whatever I say here might not work with what your situation is. So what you have to do is sometimes you have to either switch care providers or you find that other social worker that you used to really get along with. You use whatever resources you can, like just but with the thing that I think the healthcare time the healthcare system does, it just wears family caregivers down and they
Mhm.
just give up. That's the most discouraging part watching as a nurse, how hard families have to work and how much time, like we act like you guys don't have jobs and kids and dogs, that you can just make an appointment whenever to come see us because you want our services. Like there's a little like there is a shift, away from that a little bit, but Yeah, so I feel like I'm
think
rambling
what
a
it,
whole
No,
lot.
no, 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 no.
you know,
No,
and I
I
think,
think that's exactly right. Go ahead, Robin. Sorry.
well, I just think, to your point, Jean, I think, one of the things that is a part of the learning curve, and maybe what we need to do is like create a lexicon for people. But there are so many different titles of people in the healthcare system, right? There's a hospitalist, there's an ER doc, there's a pharmacist. I mean, the list, it goes on and on, right?
Mhm.
And you don't always know which one of those people you need for what question you have.
Right. And sometimes they'll answer your question, though they are not licensed to answer your question.
Yeah,
But you don't know that
yeah.
as a family caregiver.
And sometimes you ask them, hey, well, can we do this? And they say, oh, you really need to talk to the hospitalist about that. They can answer, or the social worker about that. And then you're waiting again to see another person. So I think, it could be extremely useful for caregivers to have a lexicon of what are all the titles, what are all the roles, what do these people do, what kind of topics do they cover?
Mhm.
Because learning that through experience is very time consuming and
No, it's
frustrating, as you pointed out, extremely frustrating, because the doctor's only here at 6 o'clock in the morning, and you got kids to get to school and animals to feed, and
hard. It's super hard. No, and the thing, like, and maybe that's where, we figure out like a way through Daughterhood to teach it. Because like there was like a certain thing that I learned to do when I was working with families out in the community. So I'd get like the crying phone call, like Anne probably gets, or the emails, right? The whole life story, because they're just stuck and overwhelmed. And I'm not emotionally attached. So where I always approach, like when you're suddenly find yourself falling in your lap, the care of somebody else, like one, you have to decide if you want to own it or not own it. There are ways for you to not own it. And sometimes there are expensive ways, and sometimes communities have cheaper ways, and we can give you those resources. But then you've got to own the situation and own the information. And so that was the very first thing I would do is I would have families get onto like mymedicare.gov. And I want to see the doctors that they see. I want to see the diagnosis that they're talking about. I want to see the medications. And then everywhere we go, you have to like look at that as like what you said, Robin, like a team, a part of your team. And you need to understand what that team can do for you, what they're trained to do, what they know to do, how often you really need to see them. You need to see, because every office, in a hospital is even more overwhelming, but like an office, there's usually levels of care or social workers or resources that people don't always tell you about. So you have to ask about them. That's another key part of this is for some reason, we think families should just know to ask, and we don't always give information. And then in a hospital or any of these like this different nursing homes or whatever, there's a whole culture, and it's like you have to like get in there and learn the culture. And I don't know how to like shorten that learning curve for family caregivers yet, other than talking to another daughter or going to a daughterhood thing to say, all right, like if you got to make sure your care plan meetings are every quarter, don't let them skip on them. You want them in person. And here's a sheet I use, right? Like there's got to be things that we can hand to each other to make that process easier.
Well, and I think you have to also, one of the things is they're not all created equal. These care facilities, they're not all created equal. Just like hospital care, it really falls upon the caregiver to figure those things out. And it's like an onion. You're peeling away layers and layers of healthcare within any of these places, the hospital, the ER, the assisted living or nursing home. You're just peeling away at layers until you get to the layer that you need, and has the answer you need. And most of us don't know that until we have to do it, so it seems like there's so many things that we learn along the way that we could write a manual, like when your parent goes from assisted living over to the hospital, they don't necessarily send them the meds record. You find out, oh, what do you mean she's not getting this? She's supposed to be getting this blood pressure medicine. Well, they didn't send that to us. Yeah, right. Yeah. Or, they give them a med they're supposed to have at nighttime, and they give it to them in the morning, and you come in the room, they're like, why is your mother so sleepy? We gave her this med. Well, that's a PM medicine. You didn't get that information? No, we didn't get that information. And you don't know. You don't know you're supposed to do all those things.
Yeah, I just have to tell you guys, like, just for me personally, my whole life, I've had this, when I take all those personality tests, getting to Jean's point about humans, like, so there's humans that work in the health system, and then there's humans on the other side. And my human nature is to be very intolerant of any kind of bureaucracy. I think it makes me personally anxious, sort of like I'm not in control and I'm dependent on this sort of bureaucracy and I can't seem to, it's like I press on this and nothing moves. And then I start to get just mad. And I really I definitely have made the mistake of being like, and you guys, I'm embarrassed to admit this to everyone on this call, but where I'm sort of like calling my dad's oncologist. I'm like, I work in Washington, D.C. on healthcare. So like,
I know people.
I know you work for the HCA and I know exactly what's going on here. And, which is a ridiculous thing to do. It's so embarrassing, but also like I was desperate and so upset. And I think that was not helpful. That did not get the result that I wanted. It just made things worse. My parents are like, can you just, maybe you should stay out of this. But I mean, that's like,
no. Well, and I've had those situations where families, I'm like, well, why haven't you spoke up? And especially when you have your loved one or family member in a facility where they live and you have to leave. And they're like, we feel like if we speak up that they'll hurt them. That breaks my heart. Like, I like that.
Yeah.
But it is a very powerless feeling.
Yes.
So like you get Anne's, anti-bureaucracy, feeling powerless. And then the emotions, and it's a recipe for that. And Robin, how, because you're in your just training, especially with corporate and everything, like how do you deal with that conflict? I feel like you have really good insight.
Robin's really got great.
I learned a lot from Robin.
I know, me too.
Well, thanks. Well, actually, it's funny because I teach a class in my leadership series called Tough Conversations. And I have recently reformatted that class for caregivers called the Awkward Conversation. And it has to do with having that conversation with your parents, about all the necessary documents and end of life wishes and so forth. But it also has to do with, it's kind of like a 4-step process to get ready for an awkward conversation, because it's going to be that way. And so there's 4 steps and there's 3 techniques that I teach in that class. And they come from my leadership training, but they are perfectly adaptable to this environment. And I've used those when I was with my mother because it brings me a peace of mind. I, sit down, I set my intention, I set the desired outcome I want for the conversation. And also, one of the things is if I need to find a middle ground with that healthcare person, then we need to find the middle ground. If it has to do with medications or it has to do with treatment post-hospital or any of those things, or if it has to do, look, these are my expectations, how can we meet those? Because I think a lot of times as caregivers, back again to relying upon the medical team to tell us what's best, they may not. Like with an elderly person who's in a hospital, they get weak very quickly. And so one of the things I learned pretty quickly was to ask for PT, starting right away. Get the PT in here once a day, please. Once a day, please. Because otherwise they lose everything and they go home, in worse shape than when they went in. And it takes them longer to come back. But anyway, I repurposed this course called That Awkward Conversation. And there's a 4-step process and there's 3 techniques that you use. And it's setting your intention, setting your desired outcome, and understanding who you're talking to. Who's your audience?
No, and then one that, I went to over 400 hours of appointments with older adults and doctors. And that was super enlightening because I understand their world. I understand all the nuances of what's behind the scenes and what's happening. And some techniques that I learned, one is I humanize the person in the room because I know that doctor's walking into that room. They're thinking 88-year-old cancer, of COPD, diabetic, rolling their eyes, thinking all the workup they're going to have to do. And I would just tell them something to make my my person that I was with, like something different. And like one was, she used to fly airplanes. I'm like, and she's like
Oh, yeah.
4 foot. She's like 4 foot. You would never guess it, right? And I'm like, did you know Molly used to fly airplanes? And like, it just would set the tone of that like appointment a little bit different. And I knew I put it a little bit in their head. It's not just, this 88-year-old blah, blah, blah. It's Molly that used to fly airplanes. And then when we were in stuck decisions, because there's a lot of great decisions you're going to make as a family caregiver that the doctors aren't going to tell you what to do.
Right. Yeah.
And when we would look for insight, when I wanted insight, because I didn't even know what to advise, even as a nurse, I would just look at the healthcare provider and I just say, if this was your parent, what would you do? Because one, it shows them how stuck we are. And then it sometimes would give us insights of what they felt was important. So it was just, I think your techniques are awesome as well, but just, I know sometimes like just to know what the words are to say, because sometimes you're in these situations where they're using words way out, right? So like, just think, you got emotions, you're not in power, and you feel stupid. Like, no wonder why we all act like crazy in the doctor's office, right? Like,
I know. It's amazing we all haven't been arrested.
Jane, I think the humanizing comment is so on target, because one of the things when your old parent, pardon me, old parent, but your parent who's 90 years old, 88, whatever, is lying in an ER bed and they're confused and they can't talk straight, you're the one that has to do that for them. And so the nurse comes in or the doctor comes in and they're just doing their thing and they're asking questions and typing them into that little computer there. And this is just to them, it feels like, it may not be, but it feels like as the caregiver, this is just an old person, with old tired veins that's getting bruised from the IVs that you're putting in, who can't seem to communicate with you because she's confused. And this is just an old person. So I really love that. And I used to tell people, like when my mother was in any of those healthcare situations, I said, did you know my mother was a wave in World War II?
mm-hmm.
And that would stop them in their tracks. What? I'm like, yeah, she was 20 years old and she signed up. I love that. I love that point you made.
And then the hospital, like my favorite patients were the families that would bring pictures and hang up. Like, we don't get to see your loved one not sick. We don't know what their baseline is. Yeah. We see them as we get them. And all our goal is to see if we can make them better. And we're trying to believe you that they used to be able to walk and talk on their own, but it's hard to believe that when you first meet someone and they weren't talking and walking. So it's hard to visualize that that's what we're getting back to sometimes. So seeing those pictures of them healthy and like with the family, I was a night nurse, so that kind of stuff, I didn't always get to see family, in the middle of the night. So it was nice to kind of see this person in the bed and try to guess what their story is. But there's also just to also give you kind of like a peek under the skirt, like healthcare is constantly trying to help like the healthcare workers be human, right? And they're dealing with all the personalities. So like we had to do a training as nurses called Aid It, because some people for some reason don't go in a room and introduce themselves. So we literally had to have a check off where we had to ask and introduce, and I forget what DT stood for. And then like your muscle thing, about asking for PT, Robin, like I still remember at night going to sit and pee, because that's how they educate nurses. Because that's in our one moment we have a break to take a bathroom break. They put all the education on the back of the bathroom door. And so I remember reading, and it impacted me. And it said that every day you don't move your patient, they lose 10% of their muscle. You better believe after that, I started doing passive and putting PT orders in. And so I think that's where like your efforts of, what can family and caregivers do? How do you feel less powerless? I think it's trying to figure out like how to, because the other thing is like, we just have a total ageism against this. Like we just don't know how to take care of older adults because we don't know how to include families, because we want to turn to the patient. I remember families laughing at me because I had to get the patient to answer these questions, and the family's like, she hasn't known the year since, 1950. But yet I have to do my assessment and do all this stuff. And so as families, I think it's to just constantly, even though it doesn't, maybe we don't welcome it, but educate us, ask questions. Like it's a two-way, and it's hard. And I know it's so hard because I know the spectrum of nurses and doctors that you're up against. Yeah.
Yeah, and I think, there's a terminology too. We talked about what's the lexicon of roles and titles, but then and you just mentioned it, baseline. The first time my mother was in an ER, and they said, is this her baseline? I didn't know what they were talking about.
Right.
So I said, what do you mean? So I got educated because I asked the question. Well, then I knew. Well, then, of course, I knew every time she would go to any medical sort of encounter, I had to say, this is not her baseline today. She's got a UTI. She's a little confused, or,
No.
you have to become so educated about so many different things as the caregiver, from what are the side effects of UTIs, and, what are signs of a stroke. And I mean, it's amazing how much you learn. But you're not the expert, but you're the expert at your family person.
Right. I'm going to jump in really quickly because there's a couple of questions. I've gotten a few privately, I think people are getting so excited about this that they're sort of like, where are the tools that are out there sort of on the internet that we can use to guide these conversations? And I sent a couple or at least one in the chat, and I welcome I should have thought of this in advance, like, I should, but we'll also include links to things that we know of and actually we'll pivot in a few minutes to kind of like, also who can you call and what professionals you can bring into your orbit. But I wanted to just say that somebody asked a really good question, which there are two I want to make sure we answer. This one is about when you have a loved one with dementia. And that person has behavioral issues. So, they're combative with the staff, and maybe also combative with you. I think these are my view, are the most challenging situations to manage because you've just for obvious reasons. And I was curious, I can't remember, Robin, if one of your parents had dementia.
My mother had a mild case of vascular dementia. And I mean, it mainly caused some confusion for her, especially if she was in a healthcare setting. So
behavior is the worst. And because I get daughters all the time that because the facility is like, well, you have to come get your parent. We're kicking them out. Like, and there is not a good place to go. And there is not a good plan. Like, well, one, we're like learning about dementia, right? So you're dealing with a disease that is still being understood by medical community. You're still fighting things that older doctors are doing that aren't appropriate in this day between, the types of drugs they're putting them on. And so it is definitely in an area where, to me, when you're trying to learn what to do, I always go to either community or an association or a .org. Those are kind of like my three levels of places of like, okay, obviously the people I'm working with don't know crap about this. How do I educate myself to then advocate? But I have no good advice of like when you are in that situation, because there is not a good out. Like, I mean, because even if I told you, go home and pay $15,000 a month to keep them 24/7 care, well, then you're gonna have all issues with caregivers, quitting. And like, it is the most heart-wrenching thing to do. And other than, work with that provider, I mean, all we know in this era, I feel like, is to drug these poor folks that have this disease process. And I'm hoping like at some point we have kind of like what autism has, where it's like, oh no, if you put earmuffs on them and reduce sensory, they calm down. Like, is the behavior something in the brain? Is it a trigger of something outside? Like, it takes so much work. And so this is where actually another circle leader, Jessie Hillock, is doing a lot of work and working one-on-one with families and is a wealth of knowledge. She's actually my go-to anymore of when I don't know what to tell a family what to do.
I think just to tag onto that, I think also Anne and Jean, it's really important for people to understand there are at least five or six different types of dementia.
There's hundreds.
Not all dementias are the same. And not all dementias are Alzheimer's. And so, if your parent has a dementia diagnosis, you need to check the medical record, see what it says. Because my mother had her dementia diagnosed, not even diagnosed, just written into her record as Alzheimer's. It was not Alzheimer's.
Mhm.
So dementia manifests in different ways depending on the type of dementia it is.
Mhm.
And oftentimes, as you pointed out, Jean, the environment has a lot to do with how much it manifests in different ways.
And I remember, I think it might have been Regina on a previous call had told me, and Regina, if it wasn't you, we'll just pretend like it was, that she, or maybe it was Jerry when we did our last call in June, essentially led the training with, I think it was Regina, led the training with the nursing home staff about how to deal with her parent. Like it was, and I think drew upon some of the, like Teepa Snow, as we always mention her, as the, guru of all things to do with dementia and behavior and managing it. But sometimes the folks in the nursing home, particularly, I'm thinking of, actually really will be receptive to some training, and like that's a very creative solution as a family caregiver, basically to offer training to your parents' caregivers. But I think it was really helpful, really worked.
Yeah, I saw on Instagram a daughter, because she got so tired of, she felt like the caregivers that were coming to her parents' house, like never referenced the, the care plan book or whatever. And so she got tired of re-explaining everything and things not being done right. So she literally put sticky notes on everything. And I know there are, and again, back to personalities, there are caregivers that would probably piss off because they think they're not, because they're assuming those sticky notes is that daughter saying that they're not doing a good job. But as someone coming into especially a house environment where you don't know where anything is, how it looked before you got there, or what it should be doing, those sticky notes would help me direct care of what I need to be doing,
Mhm.
and and again, it's kind of like working with that team of what would be helpful, and again, setting those goals. Like it's like you take a deep breath, you put those emotions aside, and you're like, but how do we get it where my dad or mom can get to this point, right? Is this point possible, and how do we get there together? Like showing that you'll put work in if they put work in. This is not just me, this is together, we need each other to get them.
Yeah.
One of the things I with my mother, when I had to start taking her doctor appointments and stuff, and she felt like I was invading her privacy and I was taking charge. So more than I said, look, I really just want to be your partner. Daddy's not here anymore. He was your partner in this before. Let me be your partner and we'll talk over everything. And we did. We talked over everything. And sometimes I did have to make the decisions, but I never left her out of the process. And letting your parent know that you're the partner and not the decision maker, even though you may be at times, helps to preserve some of their dignity and independence.
Mm-hmm.
You're muted, Anne.
I looked for my sound. I was like, is it my sound? Did it finally get out?
And I think Susan and Robert behind the scenes were like trying to unmute me. I just was flagging the time because we have 5 minutes. And
Oh, no.
I know. We could go over, except that I actually just looked at my schedule and it turns out I'm supposed to be somewhere for 5 minutes. But what I would say is, so that's how informal this conversation is that we did have one person ask a question. I want to make sure we get back to you, Robin. So it's not exactly about navigating the healthcare system, but just sort of, it gets back to kind of, how did you get your mom to agree to move?
Oh,
And, so many people struggle with, they really feel like their parent needs to be someplace other than a single family dwelling all by themselves. And it's so sometimes can be very challenging. And I think your tips on that. And then I think maybe just what I'm noticing in the chat is just an incredible hunger for more tools, like how can we organize our stuff? What kinds of tools are out there to help us? So I think I want to let Robin answer that question about working with your parent to get them to move. but just to say to everybody on this call, this is recorded, we have your comments, and I think it's incredibly helpful to see what you're looking for, so that we can, pull the brain trust together of all the Daughterhood Circle leaders and get those questions answered and send that out in a separate email. So very much appreciate all of those comments and questions, and we'll do our very best to answer all of them. So with that, Robin.
Well, there's no definitive answer to this because everybody's parent is different.
I know, right? Yes.
My mother was recovering from a hospital stay and illness, and she was in Tennessee, and I just kind of casually said, "Mom, what would you think about moving to Virginia to be closer to me? Because I would like to have you there with me." And she got really quiet. And she said, "I never thought I would be in this position." I said, "I didn't either." And she said, "Well, where will I go?" I said, "Well, I have a couple of places I'm looking at, and you can come and look at them. And we can talk about it." And I just left it there. I didn't, it was not the end of it. I just left it. And I was there for a few days, and I didn't bring it back up again. And she actually brought it up again to me. And she said, "Well, these places, what are they like?" And I told her, and because there was no way I could have her live in my home. I live out in the country. I'm 25 minutes from town. It just was not a realistic option. And my mother, as independent as she could be, I knew would not be happy living in the same home with me. But she would have had a much earlier death, probably. Just kidding, but anyway. She brought it back up to me, and she started asking me questions. How far is it from your house? And can I come out to your house? Because I live in the mountains on a small farm, and she had been here before all this. And I said, "Of course you can." And I started talking about the things we could do together if she lived in the same town, and that she could spend the weekend just out here. And I really started talking about the advantages that we would have together, rather than me coming down there once a month and running constant errands for her while I was there, that we would have more time to do things together. She had a lot of friends, but, I said, your friends are as old as you are. And they're not going to be able to take care of you. So, my mother never really, she lost her, she was very high cognitive until the end of her life, even with the stroke. And she was not thrilled with the decision, but I really let her come to it on her own. By not forcing it, by not pushing on it, by just sort of bringing it up, having the conversation. These are the options. Here's what, they're walking away from it. Let her process it. Let her think about it. Let her know she could still have her independence, but that I'm right there.
That's really, thank you, Robin. That's great. I remember Maria Shriver, once I heard her talking about her caregiving experience, and her mother, of course, being this larger than life person, was very resistant to any and all support. And it's interesting, just, look, like every single unconscious issue between you and your parent is going to just get triggered, because Maria said she was like trying to prove to her mom like that she was capable and she could handle this and she could get her the aid and and so she was kind of stepping in and being very assertive and demonstrating her grown-upness, which is like you will do even when you're 50 years old, you'll do, right? And then her mom was like resisting and then finally, there's so much that's psychological about this. I think sometimes if you're a family caregiver, if you can afford it, like get into therapy and just because everything is going to come up and it's going to, it's going to affect your ability to interact. This is a big, I guess the silver lining is it's a big personal growth opportunity.
It is.
Yeah, it definitely is.
So I'm gonna wrap, you guys, and just say a huge Jean and Robin, you guys, oh my God, thank you.
Thank you, Anne.
These are fun.
And yes, we're going to have another conversation in October, and we're going to be talking about choosing care settings, so like assisted living and things like that, with the unbelievable San Diego Daughterhood Circle leader, Karen Van Dyke. And we have a special guest as well. And so we will keep you posted when we get that date officially set. And in the meantime, thanks for joining us. And we'll send you this recording as soon as Susan gets back from vacation. Okay. So thanks, everybody.
Thank you.
Thank you, Anne. Thank you, Jean.
Bye.
Bye.
Robin. Bye.
Bye.